A very good afternoon to all of you. Yesterday we have completed the first unit. Today we'll start with the second unit. I have already pointed out to you that in the second unit, the first phase of the second unit consists of the risk management process, which we have already discussed in the last class. So no need to repeat that again. So we'll focus on the remaining part of the second unit, which is basically about the miscellaneous claim settlement process. And in the miscellaneous claim settlement process, we have four different types of insurances we discussed. One is your health insurance, one is your property insurance, one is your cattle insurance, one is your agricultural insurance. And we'll go on to find out the claims procedure being attached to these kind of insurances. So today, first of all, we'll start with the health insurance. Health insurance, as you know, is considered to be one of the major areas related to the business of insurance, not only in India, but all over the world. Because we know that health is precious for all. Every individual needs to take care of his health because we consider health as our wealth. But our health is supposed to be exposed to a number of risks. The risks might either be in the form of diseases, the risk might be in the form of premature death, the risk might be in the form of accidents like that. And if at any point of time we as individuals are being infected by any sort of or are being affected by accidents or premature death, it will lead to a huge loss on our part, which means either we have to face with severe financial losses or our kids and kin will have to face with severe financial loss. So to safeguard the health of individuals, it is necessary that the health insurance should be promoted in all parts of the world. So we'll go on to first of all discuss about the concept of health insurance and the intricacies associated with health insurance. Then we'll move to discuss about the claim procedure related to health insurance. I'm now sharing some slides with you. Through those slides, we'll go on to find out what health insurance is all about, what are the different policies of health insurance which are being offered, particularly in Indian context, and what are the basic advantages and limitations of health insurance, particularly in India. Then we'll go on to find out the claim procedure related to health insurance in India. So I'm just sharing the slides. We'll just go through it. We'll discuss it. Is it visible? Is it visible or not?
Yes, sir. Yes, sir.
Yes, sir.
So the very basic question that strikes our mind while discussing about health insurance is what sort of system it is, what sort of thing it is. So basically, we know that insurance is nothing but a process or a system. So also health insurance. So what type of system it is? It is a system which assures us to make contingencies of healthcare expenses. That means while spending for healthcare activities, whatever loss we are being suffered with, for that the loss amount will be compensated to us through this health insurance. And generally, the health insurance system is there to provide protection against financial losses by unforeseen sickness. The sickness which you have never foreseen, the sickness which is accidental or which can happen at any point of time, about which you are not certain of, or not sure of. And for good medical care, definitely it involves a huge amount of money. Therefore, the cost of good medical care, since is more, to meet the cost of good medical care, health insurance system is there. And because health insurance is there, it relieves the individuals from any sort of anxiety, any sort of tension, because they know that if at all they will be afflicted with any disease, or if at all at any point of time their health gets disordered, then for caring of their health, whatever amount will be spent, that amount will be provided by the health insurance schemes which they have done for themselves or for their kith and kin. Coming to the definition of health insurance, uh, as we know, insurance is always considered as a cooperative device. So also the health insurance is also a cooperative device, which means a large number of persons who are being exposed to the same kind of health risk, they basically go on to do the health insurance. And at any point of time, whatever percentage of those total population are being affected by the happening of the risk, the insurance company generally compensates them out of the fund that it has mobilized from those number of individuals. So just like any other form of insurance, health insurance is also considered as a form of collectivism, by means of which people collectively pool their risk. That means they have agreed together to insure themselves or insure their health against the risk to which they are being exposed to. And in this case, the risk is nothing but the risk of incurring medical expenses. Now, coming to the different essentials of health insurance, if you look at the essentials of health insurance, you can find that in health insurance, actually, you are paying for health insurance earlier before the risk happens. Once the risk happens, then out of the payment that you have made, the insurance company will go on to compensate. So the first such essential is your prepayment and risk pooling, whereby the individuals or the families pay when they are healthy and are able to pay. Whenever you are whenever your health is in no disorder, that is perfectly in order, you will pay for the health insurance. However, when they are being affected by any sorts of diseases, which includes the critical illnesses, the insurance fund can be used to finance their healthcare requirements. Secondly, health insurance functions when there are large number of persons being enrolled under it. That's why the government is also trying to persuade each and every individual to go for considered to be a must for each and every individual. So if a number of individuals are being enrolled, then the health insurance can function properly. With large number, the chances of adverse events are reduced, and so is the outflow from the insurance fund. Third essential is your solidarity. Solidarity basically means once you enroll yourself for health insurance, you need to be solid. That means you need to continue with that. That means you need to make payment for that health insurance on a regular basis. Health insurance, as you know, is always considered to be a non-life insurance. So generally it is being done for a period of only 1 year. And every year you need to renew it, just like any other general insurance. So that sort of mentality should prevail in all the individuals who are trying to go for health insurances, that whether the risk happens or not, they should continue with the health insurances. That will constitute the solidarity. So solidarity asks that a successful health insurance program requires people to contribute, knowing fully well that their contribution may not help them directly if they are not being affected by the happening of the risk, but it will help others who are jointly contributing towards the health insurance fund who require the support. So if 100 number of people have enrolled themselves, uh, there is a possibility that if the risk happens, it might affect a certain percentage of those 100 number of people. May it be 5%, 10%, or 15%. Let's suppose out of 100 number of individuals who have insured their health against the risk to which they are being exposed to, once the risk happens, it might affect 10 number of people or 15 number of people. So those who are being affected, they are supposed to be compensated by the company, and the company basically compensates them out of the fund that it has mobilized from those 100 number of individuals. So even if it might not help you directly, but it can contribute to us supporting those who are being affected by the happening of the risk. So solidarity is considered to be one of the essentials of health insurance. Then coming to the characteristics of health insurance, as we have already pointed out that insurance is nothing but a legal contract. And generally the legal contract to prevail, there has to be the presence of two parties. Without two parties, no contract can be made. And in insurance, whenever a contract is made, the two parties being involved in the contract of insurance are considered to be the insurer and the insured, where the insurer is the insurance company and the insured is the individual or the owner of that. Therefore, we just like any other forms of insurance, health insurance is also considered to be legal contract between these two parties, that is insurer and insured, whereby the insurance company and the individual are supposed to be the two parties. In many cases, you can also find that certain sponsoring agencies, sponsoring individuals are also doing the health insurance for their beneficiaries. Suppose take the case where you have joined an organization. So whoever is the employer of that organization, it is the responsibility of the employer to do a group health insurance scheme for all the employees. So there, the contract will have to be made between the insurance company and the employer. It's not directly between the individual, because the individual is considered to be one of the employees of the organization, and it is the organization which enters into a contract with the insurance company. So it's a contract between insurance company and an individual or its sponsor, whereby the sponsor might be in the form of the employer. And as I have already pointed out to you, that health insurance is considered to be a general insurance scheme, a non-life insurance scheme. So the validity of health insurance is only for a period of 1 year, and every year you need to renew it. So the contract which is being entered between the insured and the insurer is basically supposed to be renewable on a periodical basis. Specifically, it is being renewed on an annual basis. But if on an annual basis it is not possible on the part of the insured to contribute the amount of money which he or she has to pay in the form of premium, then it can also take any form of periodical renewal. The period might be on a monthly basis or on a quarterly basis or on a half yearly basis, but there has to be some periodical payment of premium in case of health insurance. But in general, the health insurance is actually renewed on an annual basis. The type and amount of healthcare costs that will be covered by the health insurance company are specified in advance. That means the insured from the beginning know that what amount it will have to contribute towards the payment of premium, and the insurance company also knows what sort of benefits it is supposed to provide to the insured in case the risk happens. Therefore, in advance, both the insured and the insurer knows the details about the insurance scheme, the health insurance scheme. Then we need to look at how the health insurance actually works. So basic elements in health insurance, as we have already pointed out, that it is the individuals who will have to do the health insurance for themselves, and they will have to do the health insurance with any of the insurance companies which are providing the health insurance policies. So if you look at the basic elements, the major elements are none other than the insurance company or the community itself, because we know that large number of people must have to enroll in health insurance. So together they constitute a community. So here community and insurer, these are two, these are considered to be the two basic elements in the health insurance. Without any community or without the insurer, health insurance cannot work. So how does it work? It happens that the community basically makes the payment in the form of premium to the insurer. And what the insurer does with that money, the insurer actually provides that payment to the health service provider. The health service providers are basically in the form of hospitals or in the form of nursing homes or in the form of any doctor. So when you go to any doctor, go to any hospital for medical exigencies, either for surgical interventions or for any other medical treatment, you'll have to pay the fee to them. You'll have to pay the amount which is supposed to be incurred for that medical checkup or for that surgical intervention. So that payment is actually being paid on behalf of you by the insurance company. So whatever premium you have given or the community has given to the insurer makes that in the form of payment or transports that in the form of payment to the health service provider. Why it is making payment to the health service provider? Because the health service provider is providing all sorts of healthcare facilities to the community. So the responsibility of the health service provider is to provide all sorts of healthcare facilities. So it needs to take care of the health of the community. That is the reason why the insurance company is paying the payment. So premium is being given by the community to the insurer. In turn, the insurer makes payment to the health service provider for the care which are being provided by the health service provider to the insured or to the community. And in this process, the insurer manages the risk to which the community is being exposed to. So risk management is there. It also administers the process successfully through proper administration. That means it has to tie up with any of the health service providers. Uh, Normally, the health service providers are in the form of third-party administration or third-party administrators basically have a network of health service providers. So insurance company actually on its own can do the administration or it can um, outsource the administration process to any third-party administrator, which is in the form of TPP. So this is how the health insurance works. These are the basic elements. So basic elements includes community, insurer, health service provider, administrator, risk manager, and quality. Then coming to the different forms of health insurances, if you look at the different forms of health insurances, as you know, health insurance is not a new concept. Actually, it was started uh, during the 1970s with the setting up of GIC, but it was not that much successful at that point of time. Then a beginning was made in 1993 by the Life Insurance Corporation LIC, whereby health insurance was being provided as an adjunct to life insurance by the LIC, but it was covering very few number of diseases. So that form of health insurance was not supposed to be successful. As a result of which, since 2001, the government has come out with a new uh, legislation whereby specific health insurance companies were being set up, and health insurance was being considered as a separate insurance, not as an adjunct to the life insurance or not as a part of the general insurance. And in modern day time period, in today's time period, you can find that the health insurance is being considered as a, you can say that, separate insurance scheme. And there are certain specific institutions who are specifically dealing with the health insurance schemes. You can think about the Star Health. You can also think about the other companies, particularly the pharma company, which are having their own health insurance
Excuse
company.
me, sir.
Yeah, yeah.
Sir, sir, can you please speak little louder, sir? It's very difficult to receive.
So as I said to you, health insurance is not new to India. It was actually being started in the early 70s with the setting up of GIC. GIC started health insurance scheme, but it was not that much successful. Then in 1993, the LIC came out with the health insurance scheme, whereby the LIC was providing the health insurance as an adjunct to life insurance policy. But the health insurance provided by the LIC was covering a very few number of diseases. That's why it was not being that successful. But since 2001, the government has made the health insurance as a separate insurance scheme, and many such companies having the expertise in the health sector have come out to provide specifically health insurance schemes in India. If you look at the different forms of health insurance, there are two basic forms. One is your indemnity insurance, one is your cash claim facility. Indemnity, as you know, is a legal term whereby it means to indemnify the actual loss, to compensate for the actual loss. In indemnity health insurances, the insured have to spend the health expenses from its own pocket at first, and by doing so, whatever loss the insured has faced with, that loss will be compensated to the insured by the insurance company. So, in case of indemnity health insurances, if you are being afflicted with any disease or if you are being faced with the risk against which you have taken the insurance policy, then you need to take care of yourself. First of all, you need to spend the entire amount from your own pocket. After that, by collecting all the supportive documents, which includes the admission into the hospital, the discharge from the hospital, the surgical intervention documents, the medicine expenses, all these documents you need to collect together, then fill up the claim form, attach all the documents along with the claim form. After that, the company will pay you the amount. So it is not possible on the part of each and every individual that even if they have done the health insurance policy, but at time of requirement, they are uh, required to pay from their own pocket at first. Although it will be compensated to them in the latter part by the insurance company, but it was not that much appealing to the health insurance uh, individuals or to the insured under the health insurance scheme. But this scheme is there. In cashless scheme, what happens? You don't have to pay from your own pocket. There is a network of health service providers in the form of hospital as well as nursing homes. You just need to go to those any of those network hospitals or network nursing homes in your locality or in your nearby locality. And in this scheme, a health card is being given to the insured in the form of a plastic card. You just have to give that card to the hospital authority or to the nursing home authorities. They will go on to process the claim amount. They will do all sorts of or provide all sorts of healthcare facilities to you as first, and whatever expenses are there, if those expenses altogether will come under the health insurance amount for which you have taken the health insurance, then the entire amount will be paid to the health service provider by the insurance company. So here the insured doesn't have to bother anything about the payment. If the payment is within the of the insurable amount. So that is known as your cash claims facility. So in cash claims, actually there is the involvement of a third party administrator. We call it as the TPA. And the TPA basically manages the healthcare system in case of the cashless claim facility. If you want to know about the TPA, then the TPA has to be uh, an entity, an organization which has to be registered under IRDA, which has to get the license from IRDA to act as TPA. And the TPS basically provides comprehensive healthcare services to their customers uh, because the TPA has a tie-up with the insurance company, or the insurance company has outsourced the TPA to take care of all sorts of healthcare facilities related to the insured. So the TPA generally provides comprehensive healthcare services to the insured. If
Sir,
you
sir,
Yeah.
is TPA compulsory in between the insurance company and the customer?
If you are trying to take the cash claim facility, then TPA is compulsory. Even if in reimbursement policies also TPA is compulsory. They have made it compulsory because we are into a managed healthcare system now. The government is focusing more on that. As you know, insurance companies have their own work to do. Those who are specifically focusing only on health insurances, they might not require the TPA. They might work as a TPA for themselves. But
Yes, sir. Yes,
the other companies, public sector companies or private sector companies who are either into the general insurance business or into the life insurance business, they are also providing healthcare facilities through health insurances. So they
Hmm.
basically outsource it to the TPA. But uh, it has been suggested by the government that there has to be a TPA in the health insurance scheme because their main focus is to uh, is to manage the entire healthcare of the insured, which is not possible on the part of an insurance company. So generally, the TPAs are those companies which are having some sort of expertise in the health sector. But TPA, before acting as a TPA, must have to get the approval from IRDA, which we call as the Insurance Regulatory Development Authority of India, and also they have to be licensed by IRDA. Only licensed TPA can work. And it is the TPA which actually does everything in the health insurance scheme. But as an insured, you don't need to deal with the TPA if you have taken a cash claim facility. The TPA will provide you the card, the health card, and the TPA will provide you the network of hospitals or network of health service providers in your locality as well as in your nearby locality. You just need to visit those health service providers in case you are being faced with the risk against which you have taken the health insurance policy, and the TPA will take care of everything. In
yes,
case of reimbursement also, if suppose you have taken the reimbursement policy, or suppose you admit yourself to one such health service provider who is not networked under the TPA from where the policy has been issued to you, then after spending from your own pocket, it is your responsibility to contact the TPA, get the claim form, fill up the claim form, along with the claim form, attach all the relevant documents related to the medical expenses and submit it before the TPA. The TPA will take care of everything, and after that they will go on to reimburse you whatever amount has been spent from your own pocket. Understood?
yes, sir. Yes, sir. Actually, TPA basically
The TPA role is
they are basically working on behalf of the insurance company, sir.
insurance company, but they are separate entities. Actually, the
Yes,
insurance companies outsource the healthcare facilities, the provision of healthcare facilities to the TPA.
yes, sir. Yes,
And
thank you.
there is a direct relationship between the insurance company and the TPA. You
Yes,
are
sir.
purchasing the policy from the insurance company. The
Yes,
insurance company in turn is tying up with the TPA. Because of that tie-up, because of that agreement, the TPA will provide all sorts of healthcare facilities to you in case you are being faced with the risk against which the health insurance has been taken.
yes, sir.
Apart from that, government is also coming out with different health insurance schemes, which we generally call as the community-based health insurance scheme, or CBHS. Then coming to the risks in health insurance, as you know, adverse selection is one of the major risks. Adverse selection means where the risk factor is supposed to be very high.
Sir, can you
Uh,
please elaborate little on that community-based health?
yeah, I'm
That
coming to that. In
okay,
come
okay,
to that, what are the different community-based health insurance schemes which have been propagated by, particularly by the government of India? We have
okay,
the
sir.
Rashtriya Bima Swasthya Yojana. We have the ESI facility. I am
Sir,
coming to that. I have the slides with me for that also. So we are going one by one. We just
sure,
look
sir.
at the risk in health insurances. One such risk is your adverse selection. Adverse selection means if sick people enroll in large numbers as compared to healthy, then automatically there will be uh, a danger for the health insurance schemes because the insurance company will have to pay a huge amount of money. So as we have already pointed out that whenever you are healthy, when you are healthy and earning money, you can enroll yourself for health insurance so that at that point of time where you require the healthcare facility, the amount or the fund can be contributed to you by the insurance company. So adverse selection generally means selecting those who are not supposed to be, who are not supposed to be insured, but you are insuring them. So that is known as adverse. So the insurance companies which are providing health insurance facilities should go on to avoid such kind of adverse selection. Rather, they should go for cream skimming. Cream skimming is just the opposite of adverse selection, where low risk individuals, where the health risk is compared to is comparatively very low as compared to the adverse selection, you go for cream skimming. Then some moral hazard means it is psychological by nature in the sense that you know that you have done the health insurance scheme. So whatever happened to your health, health insurance is there. And in that process, you are not taking care of your health on your own. That is called as moral hazard. So even if you have done health insurance, it is suggested that you should take care of your health definitely. Don't expect that since health insurance is there, I should ignore my health. Whatever will happen, the money is to be compensated to me by the insurance company. So that constitutes the moral hazard. Actually. And the health insurance program has two main functions. One is to access to healthcare, and second is to protect the household from high medical expenses at the time of illness. Okay. If you look at the importance, then average medical expenses of an individual household is nearly 6.5% of the annual income. Uh, and in in case you are being afflicted with major critical diseases, which we call as the major ailments like heart disease or kidney disease or brain disease, so they are the proportion of your annual income to be spent on medical expenses, or the proportion of your total income which is mm, to be in the form of medical expenses actually increases from 6.5% to 37.4%. So
Sir,
around 60. Huh.
sir, ଟିକେ voice slow ଶୁଭାଯାଉଛି ଟିକେ ଜୋର କୁହନ୍ତୁ।
Now coming to the importance of health insurances, I am pointing out to you that the average medical expenses of an Indian household is 6.5% of its annual income. So on an average, an individual household, whatever he or she earns on an annual basis, he or she has to spend minimum 6.5% on medical expenses. It is a statistical observation. But in case the insured or those who have been insured under the health insurance scheme, they are being afflicted with major ailments like critical diseases, like heart diseases or kidney diseases, then they will have to spend 37.4% of their annual income. So according to study, around 65% of people remain in debt for life due to their expenditure on major health problems. Since they have to pay a huge amount of money for medical expenses as they have been affected with major ailments, So it has been observed that most of them are actually standing on a debt trap because they collect money from different sources to pay for the medical expenses, and after that they are under a debt. That is the reason why everybody, including the government, is suggesting to do a health insurance scheme so that you can come out of that debt trap. So that at your point of requirement, the health because of the health insurance policies that you hold, you can be compensated with the loss that you might have to face. Uh, Similarly, direct out-of-pocket payments could push 2.2% of all healthcare users and one-fourth of all hospitalized patients into poverty in a year. So this statistics is actually showing that people are actually reeling under heavy debt trap because of the health disorder. To meet the health expenses, they are being pushed to debt trap. That is the reason why there is the importance of health insurance. Now, coming to health insurance in India, you can find that if you look at the budget of our country, you can find that nearly 3 to 4% of our total GDP is being contributed towards the protection of health of individuals by the government itself, which is considered to be very low. Now, as one of you was pointing out about the community health insurance scheme, CHIS, the government of India has come out with different community health insurance schemes. It is the government program whereby the government is providing all sorts of healthcare facilities to its employees. One such scheme is your ESI scheme, and it was actually introduced in 1948. From time to time basis or on a time to time basis, it has been amended, and ESI facilities is being available both to the government employees as well as to the general public if they have taken the ESI facility. Under it, the major benefits are the medical benefits, the sickness benefits, the maternity benefit, the disability benefit, like this. The second such policy or second such scheme by the government of India is your Rajiv Gandhi Shramik Kalyan Yojana, where unemployment allowance equal to 50% wage for a maximum period of up to 1 year. So because of sickness, because of health disorder, suppose you are out of your job, out of your work for a brief period of time. So during that period, under this scheme, that is Rajiv Gandhi Shramik Kalyan Yojana, you will be provided with 50% of your wage for a period of 1 year. Medical care for self and family from ESI hospitals or dispensaries during the period IP receives unemployment allowance. Vocational training provided for upgrading skills, expenditure on fee, traveling allowances borne by ESI. So these two are the major. But nowadays, we also have some other things. Then community general health scheme established in 1954. These are the different services which are being provided by the government. It is the government which is pushing a lot the health insurance schemes to be enjoyed by the public in general as well as particularly by the government employees. Apart from that, we have the Rashtriya Swasthya Bima Yojana, which was actually being operational from 2008-9, and almost all the districts of the country are being covered under the Rashtriya Swasthya Bima Yojana. And the objective of this is to provide health security for the BPL workers in the unorganized sector and their families through an insurance that covers for hospital expenses. As you have observed over the time period, many state governments also have come out with different health insurance schemes. In case of our own state, Odisha, we have the Biju Swasthya Kalyan Yojana, whereby 5 lakh rupees is being provided by the government. And in case of female members of the family, if are being afflicted with any disease or if are being medically admitted for any sort of surgical intervention, then up to 7 lakh rupees is being provided by the government to the female members of the family. Just like government of Odisha, some other governments also have come out with the uh, health insurance scheme. So it is the government which is actually providing major uh, health insurance schemes to those who are not actually being covered under the health insurance schemes, uh, which are being provided by the insurance companies. Because in case of insurance companies which are providing health insurance schemes, we need to make the premium to them, whereby the premium amount is very high. But the government is actually providing it free of cost. Uh, they have identified the BPL family. They have distributed the uh, health cards to them, and by using those health cards, they can take the healthcare facility. If you look at the advantages of these government initiated health insurance schemes, you can say that the advantages include prevention, whereby prevent diseases through early detection and doctor recommendation for lifestyle changes, then peace of mind and less lost time. These are the basic advantages. And limitations, which basically includes the limited coverage. As I've already pointed out, that they need to identify the BPL families. There are certain criteria which you need to fulfill to be covered under the government schemes. So Biju Swasthya Kalyan Yojana cannot be enjoyed by each and every individual living in Odisha. So there are certain criteria. If you qualify on those criteria, then you will be eligible to get that. Not all. So it has been observed that only around 10% of the population is covered through health financing scheme. Uh, and selection criteria by suppliers often restricts the poor from affordable prepayment schemes. These are the issues and limitations. Now coming to the health insurance claim procedure. As I've already pointed out to you that there are two major types of health insurances. One is your uh, indemnity health insurance. One is your uh, cashless claim facility, or you can say that managed healthcare system. In managed healthcare system, actually the cashless facility is being provided, and in indemnity, you need to pay from your own pocket. After that, you will be compensated with the loan. Now, coming to how these health insurance policies claim procedure takes place and how does it work. As you know, the health insurance claim or a medical insurance claim is basically being made by the insured or the policyholder for compensation of the expenses incurred for the treatment. So the insurance company, upon verification of the claim, either settles the bill directly with the hospital or reimburse the amount you spent, depending upon the type of policy you have taken. Now, coming to the types of health insurances, one is your cashless claim, one is your reimbursement. So, since cashless claim is basically uh, is going on a rapid basis because most of the policies are in the form of cashless policies. So, what is the procedure of claim being involved in it? That thing we need to know. In a cashless claim, basically the policyholder seeks treatment from any of the network hospitals because of the involvement of TPA. The TPA is having a network of hospitals, uh, and you need to seek the treatment for your health from any of the network hospitals. On admission with the hospital, the policyholder must produce the cashless health card provided by the insurer, and the expenses incurred for the treatment will be directly settled by the insurance company. The insured is not supposed to pay a single rupee. And for cashless claim, the insured only needs to show the health insurance card at the time of admission in the hospital. Uh, there are generally two ways to claim for cashless treatment. One way is when you take a planned admission in the hospital, and one way is when you take an emergency admission in the hospital. Suppose your health is getting, uh, you can say that um, and your your health is, suppose day by day your health condition is deteriorating, and you consult with a doctor, consult with a hospital. The hospital, after checking your health, suggest you to go for an operation or to admit yourself into the hospital for further checkup and further treatment. So that constitutes a planned admission. So once you know that on a certain point of time you are going to be admitted to the hospital for treatment of your health, you have to uh, carry out the process of claim with the insurance company. So cashless procedure for planned admission. It includes you first of all have to choose a hospital from the network of health service providers as mentioned in the insurance document. Then you need to inform the TPA 3 days prior to admission and provide a membership number. Then you need to fill a cashless request form at the hospital. Then submit the form and medical records to TPA. You need not have to submit it. It is the hospital authorities or who are in the charge of that in the hospital. They will have to submit the form and medical records to TPA. TPA will go on to inspect all documents. Once approved, the insurance company will settle the hospital bill, which excludes the phone charges, attendance charges, and food charges. These charges will not be paid. It will be paid out of your own pocket. And in case of disapproval by the insurance company, you can file for reimbursement. Similarly, suppose on an emergency basis you are supposed to admit yourself to the hospital. In case of emergency admission, the cashless procedure includes you immediately have to inform the third party administrator, provide a membership number, then fill the cashless format in the hospital certified by a doctor, because the doctor needs to certify the emergency admission. You have gone to the hospital and the doctors are asking you to admit yourself immediately. So they are the reason for which they have asked you to admit yourself immediately. They need to certify it. That is the reason why in case of emergency admission, what is the reason for which you are being asked to admit yourself on an emergency basis, that has to be certified by a doctor. And that certification by the doctor has to be submitted before the TPA. Send the form along with medical records to TPA. If a cashless facility is sanctioned, hospital bills will be settled directly. In case of reimbursement, as you have already discussed, that initially the insured has to pay for the treatment and then file a claim for reimbursement. When the insured is supposed to file a claim, he or she must produce the bill and showcase other records of the money spent on hospitalization and treatment. The insurance company, after receiving all the documents along with the claim form, will verify the bill, and on the successful completion of verification, the insurance company will credit the amount to your bank account. The reimbursement procedure for a claim in case of health insurance basically involves get in touch with your insurance company through toll-free number, settle all the hospital bills from your own pocket, present the bills, prescriptions, discharge summary, and other necessary documents when you request for reimbursement. Download and fill the reimbursement form available on the insurance website. Many times you can also visit the branch offices and collect the claim form from there. Submit the claim form along with medical records to the insurance company. After that, a check will be disbursed once the claim is approved. Either a check will be disbursed or in the modern day time, then actually your account is getting credited for that. So this is how the health insurance scheme is actually working in India. We pointed out what health insurance is all about, why health insurance is necessary, why it is important, what are the things which are involved in health insurance policies, and ultimately we also went on to find out the claim procedure being attached to this health insurance policy. Clear?
Yes, sir.
So tomorrow we'll go to discuss about the property insurance and cattle insurance. थैंक यू।
Thank you, sir.
ସାର୍
କୁହନ୍ତୁ।
ସାର୍ ଆପଣ ସେୟାର କରିବେ ତ ପିପିଟି?
ହଁ ମୁଁ ସେୟାର କରି ମୁଁ ଦୀପକ ବାବୁଙ୍କୁ ଦେଇଥିବି, ତମେ ତାଙ୍କୁ ନେଇଯିବ।
ଆଜ୍ଞା ସାର୍।
ପିପିଟି ସେୟାର କରିବି, ମୁଁ ନୋଟ୍ସ କିଛି ଦେଇଦେବି।
ଓକେ ସାର୍, ଥ୍ୟାଙ୍କ
ଫାର୍ଷ୍ଟ ୟୁନିଟ୍ ତ ସରିଯାଇଛି, ମୁଁ ଦୀପକ ବାବୁଙ୍କୁ ଦେଇଦେବି। ନା ଏକାଠି ସବୁ ଯାକ ଦେବି?
ନା ସାର୍, ଆପଣ ଗୋଟେ ଗୋଟେ ୟୁନିଟ୍ ଦେଇଦେଲେ ତ ବହୁତ ବେଟର ହୁଅନ୍ତା ଯଦି ଆପଣ ଦେଇଦେବେ।
ତାହେଲେ ମୁଁ ଆଜି ଦେଇଦଉଛି ଫାର୍ଷ୍ଟ ୟୁନିଟ୍ ଦୀପକ ବାବୁଙ୍କୁ, ଦୀପକ ବାବୁ ଆପଣଙ୍କୁ